Hi, Jesse Canone from LoseTheBackPain.com, and today I want to talk to you about the biggest physical cause of various types of back, neck, and sciatic pain. And one of the things that most people don't realize, and I'm willing to bet if you've seen a doctor or a healthcare professional, they probably haven't talked to you about this either, and that is muscle imbalances, and how muscle imbalances pull our bodies out of alignment and out of their normal, healthy position, and basically create what we call dysfunction. So I'm going to walk you through one of the most common dysfunctions, and this particular one is actually the most common cause of lower back pain. So if you look at my fantastic artwork here, you'll see that this is a representation of normal pelvis and spine with a healthy curve here in the spine. What happens with muscle imbalances is the muscles that are normally, in the front of the hips here, and in the back here, the glutes, okay? If they're balanced or close to balanced, you have a balanced scenario, healthy spine and pelvis. When your muscles are out of balance, again, when you have muscle imbalances, the muscles here in this case are so strong, they're pulling the front of the pelvis down, okay? They pull in the front of the pelvis down in the front, and the back of the pelvis then tends to tip up, okay? When this happens, it's impossible for your spine to not increase the amount of curvature you have in the lower spine from here to here. Okay? Hopefully you can see that with my picture here. You're going to have an increase in the curvature in the lower spine, and when that happens, you're going to have an increase in the amount of pressure on the vertebrae, on this, the backside of these vertebrae, and also the discs. So again, if you had your vertebrae here, okay, as this happens, this whole backside is going to get tight. Now that's just the vertebrae and the discs. That's not to mention the effect it's also going to have on the muscles here. All the muscles in the lower back are going to be shorter and tighter. They're going to be under constant pressure and strain, and they're going to be easily aggravated. So you go to bend over and pick something up and, oh, my back hurts. Well, that's because these muscles are in a bad state. They're constantly irritated and constantly tight. Again, this is, just a basic overview of what's happening here. There's other muscles involved. You've got the muscles of the stomach here that aren't doing their job. So weak stomach muscles, tight hip muscles pull the pelvis down. Weak glute muscles, again, and as a result, tight lower back muscles. Most people, one of the biggest myths out there or misconceptions about treating back pain, especially lower back pain, is everybody says, oh, you need to strengthen your back. Well, that may be true, but if you go to strengthen your back, and this is the scenario you have going on right now, you are just going to irritate it and make it worse. It's not going to solve the problem, not even close, okay? So forget about trying to strengthen your back. Focus on identify and addressing the muscle imbalances that you have. Again, this is just one of 4 common scenarios that cause nearly all back, neck, and sciatic pain. We teach you how to do this in our Lose the Back Pain system. We show you all 4 dysfunctions. We show you what causes them, all the different muscles involved, which one's too tight or too strong, which one's too weak and stretched out. And we show you how to find these on yourself. It's very easy to do. You don't need a doctor, and first of all, again, good luck finding a doctor who even knows this. But you could do this. It's easy. 50,000 people have done it already. We've already helped 50,000 people all over the world, countries I've never heard of, identify their muscle imbalances and get rid of their pain. It's simple and you can do it. Okay? Again, this is one example. There's others. One other thing I forgot to mention that I mentioned now. One of the easiest ways to spot this for yourself is with visual assessment photos. Basically what you would do is you would take pictures of yourself from the front, from the side, and from the back, and you would look for these dysfunctions. They're very easy to spot. So I'm going to show you now what it might look like physically on your body. Again, my art is one thing, but let's look at the body. So this dysfunction is basically a forward tipping of the pelvis. You might notice it in yourself by looking in the mirror or in people around you, but it's basically, again, the front of the pelvis tips forward and you get this arching of the lower back. Now, normally when the pelvis tips forward, if the spine stayed where it was normally, you'd have a leaning forward, and you might see this. You might have this, or you might see this in other people. But most people want to stand up straight, so you've got the pelvis tipping forward, trying to stand up straight, and you've got this excessive arch in the back, setting you up for all kinds of problems. Again, both disc, vertebrae, and muscles, okay? So again, it's tightness here in the hips is pulling the pelvis forward, and weakness here in the abdomen to counteract that. Normally, if these are stretched, fairly stretched out, not overdeveloped or overly tight, and the muscles here in the abdomen are strong, they help pull it up and keep it what's called neutral pelvic position. So I hope this gave you a basic understanding of this dysfunction. Again, like I said, there's 4 others. There's actually more than 4, but these are there's 4 really common ones, and I'm pretty certain you'll be able to spot many of these in yourself. Also, actually, another thing I forgot to mention is you can actually have more than one. So out of the 4, you can have 3 or 2, and so it's very common. We all have muscle imbalances throughout our body. It's not just in the pelvis. Carpal tunnel in the wrist, shoulder and rotator cuff problems, knee problems. Almost every physical ache and pain that you have or physical condition, muscle imbalances are a factor. So I recommend you learn more about them. You can learn more about muscle imbalances. We've got videos, articles, audios on our website, losethebackpain.com.